now. So let's invite the administration in. Members, Secretary, have you had lunch yet? So, what should you do? You only have half an hour.
你好，歡迎各位
Welcome. Officials from the administration, including Secretary for Labour and Welfare and Undersecretary for Home Affairs. Good afternoon. So, Secretary, would you walk us through what you're going to brief us today? Madam Chair, this is a continuation of the last meeting. I have nothing to supplement. I am happy to take questions from members and listen to members' views. We didn't have much time last time, so I'd like to have a further discussion in greater depth and in greater details. And the Secretary, the same as well, will listen to members' views. So any questions from members? Dr. Fernando Cheung. Thank you, Madam Chair. Now, last time, I was asking questions about the Elderly Services Program plan, and I'd like you to give me more details in terms of the voucher for residential care services, in terms of continuum care in the community and residential care for elderly and people with disabilities. You should have a comprehensive plan taking both groups into account instead of dividing them up based on age. It should be based on needs rather. So I don't know if Secretary would come up with any new ideas in the future. And there is another question on the Hong Kong Paralympians Fund for elites, athletes and disabled athletes. They're treated differently. So, Secretary, I don't know whether you have considered it. Meanwhile, if no progress has been made, it seems our views have been ignored. And about the age-in-place scheme in mainland, I could only say that this is a choice because elderly people are most concerned about their health and their family relationships. If they need to receive residential care, that means their health might not be very good, and when they have urgent conditions for requiring medical attention, they might not trust the mainland hospitals, and they would need to be taken back to Hong Kong for treatment. So this is not a good idea. And another point is that elderly people would like their relatives to be able to visit them. They would like to age in an environment which they are familiar with, unless they have relatives in the mainland. I don't think the administration should send all the elderly people up to the mainland in order to resolve the problem. This should not be the direction. And in this year's policy address, the $2 concessionary fare scheme will be extended to public light buses, but it's not, or GMBs, but it's not user-friendly in terms of PWDs. The wheelchair-bound don't usually take minibuses. I still have a lot of other questions, so I'll just save some time for you to respond first. Last time we offered our views, so have you rethought on our views on elite athletes? I'll ask Undersecretary to respond to it. On the elderly services program plan, we haven't started formally the preparatory work with the Elderly Commission. After the announcement by the Chief Executive, the Commission will take 2 years to formulate the plan. And you are right in pointing this out. It should not be defined by age, but it should be defined by needs. So I would urge the panel to give us views on how we could improve our continuum care services. As for aging in the mainland, I must emphasize that we are not sending our elderly people away, and that's the end of the matter. As you put it, we're giving them more choices, and elderly people can make their own choices. They may prefer to reside in Yantian, Zhaoqing, or Yantian. So we're giving them more choices. We're not encouraging them to move up to the mainland, because we still need to formulate complementary measures to refine the system. And you're right in pointing out the medical aspect and whether relatives can visit them. For Yantian, agreements have been signed, and starting from the second quarter, those on the waiting list will be notified of such choices, and they would be notified of matters to note and processes to go through should they make this choice. On medical service, Yantian is closer to Hong Kong. In fact, from Sha Tau Kok, from the institution in Yantian to Sha Tau Kok, it will only take just an hour to reach the North District Hospital. And there will be coaches, and there will also be shuttle buses with several trips a day to facilitate the families to visit them. So on going through customs at Sha Tau Kok is very close. It's just a 10-minute or 20-minute journey from the BCP. As for healthcare, apart from the point I mentioned, we'll also consider whether this plan can be extended to Zhaoqing. And there's also a hospital called Gao Yao People's Hospital. This is a district hospital with comprehensive facilities. And the RCHE will take out insurance policies for these elderly people at around 680 RMB per month, or around 800 Hong Kong dollars a month. So for these organizations, we will be, for the Helping Hand organization running this RCHE, we will be discussing with them. And if the elderly people are required to come back to Hong Kong, the journey would be longer because it's farther away, and the fares might be higher. And we will consider, we won't rule out the possibility of subsidizing their transport fares, and we're still discussing with the organization. The idea is to provide more choices to our elderly people to facilitate them, and it's absolutely not the case that we are pushing them to the mainland. For fruit money, even those residing in Guangdong are eligible, and for the OALA, we can also consider whether elderly people aging in Guangdong can become eligible. Our focus is on diversity. The $2 trip concession, thank you for your support. We aim at helping more elderly people. As for in the first phase, it's true that for minibuses it's not convenient to the wheelchair bound. But on the whole, in the long run, we need to consider for public transport, how can it be made more accessible to the disabled? Well, it can't be implemented overnight. It will take a gradual approach. We will offer a $2 fare for them first and consider it further. By 2015, I understand for franchise buses, all bus fleets will be equipped with low-floor buses. and I will defer to Under Secretary to say something about the elite athletes. Dr. Fernando Zhang is concerned about the level of awards in international competitions for disabled athletes. We based our considerations on the level of participation and level of competition, and we have substantially increased the awards for elite disabled athletes in 2009 and 2013, and if necessary, we will further review the level and consider raising it. Under Secretary, I wasn't talking about the award. You should wait for the second round. You've spent 9 minutes. Next, Mr. Poon Siu Ping. Thank you, Madam Chair. On the long-term welfare planning, last time I asked, and Secretary mentioned that sites will be identified with the welfare organizations in building more residential care homes. I have a feeling, and I wonder whether in terms of long-term planning, the administration is formulating a long-term plan, because in the services provided can't match the needs, and this view has been reflected at this panel before. So in terms of the coming 5 years and 10 years, has the administration considered the demographic changes and how we should expand our services to meet the needs? And Secretary and Madam Chair also visited Shek Tai Lang, some homes at the district level. In terms of identifying sites and deploying manpower resources, are there any long-term plans?
All right. Last time you also talked about some plans or programs run by the private sector. So can you give us more details? All right. We have already given up on some short-term thinking. We try to look into the long term. That's why in terms of elderly services, we have taken a major step forward. Yes, in terms of our planning. At present, with an aging population, indeed our hardware and software are far from adequate. And as I explained last time, as set out in the policy address, one of the breakthroughs is that we have this scheme that is the private site for welfare purposes, and will be taking a proactive approach in looking or in identifying land, and so we will try to make the best use of the site, so it can be redevelopment on situ or giving you the site. For example, Pok Oi Hospital has been granted a piece of land by the donation of a private developer, and as a result, some 2,000 places for the elderly can be provided there. So it's a residential care places. So it helps. It goes a long way in relieving the pressure. So that's under the pilot scheme, and we have some 40 institutions making some 60 suggestions, and some 9,000 places can be provided for the elderly, and 7,000 would be residential care, 2,000 plus daycare services. And then in terms of rehabilitation places, some 7,000 places have come out of that, and 2,000 would include residential care, and others include daycare, day training, sheltered workshop, and also for children's rehabilitation training and so on. So for the 17,000 places coming out from the policy address, there is a breakthrough, so that in terms of hardware, we do have a basis for our long-term planning. That's why for elderly services, we need to look at that more comprehensively. You also talk about additional facilities to be provided. Definitely, because out of the 40 plus programs or projects, well, some would be coming on stream in 5 years, and then in the longer term, in 10 years, I'm sure we'll be able to see the fruit of success. All right, in the anti-northwest or anti-northeast development area and Hong Shui Kiu and so on. Yes, there might be a competition for land, but then have you made any preparation for that? And last time, Shek Tai Lang was a case in point. Bureau Director, yes, in the new development area, definitely where there is a site, we will try to zone it, and we will make plans for GIC facilities, and we will have residential care homes for the elderly, and then in the NDAs and where there are urban renewal projects, as I said last time, some 11 development projects have already had sites set aside for the construction of contract homes for the elderly. So there would be 11 homes, and there will be an average of about 100 places for each home. So we're talking about some 1,150 places. So as you said, we have set aside places in order to meet the demand. So we have done that already. Bureau Director, well, for the 11 places, you haven't given us the details about those locations. So can you provide the details to us? Yes, indeed. Earlier on, we have already provided the information, but then I'll be more than happy to give you a list. All right. Next, Lang Kwok Hong. All right, on GMBs. You said that the $2 fare scheme should be introduced first, and then you'll be approaching the green minibuses operators to see if they are prepared to offer barrier-free access to them. Well, I think it's just rubbish, because they are not supposed to be philanthropists. They are not doing charity business. So unless you say that you're going to reimburse them, or else what's the basis of such negotiation? Even if you ask them to run one trip less, they are not willing to do that. And then for minibuses, we have received a large number of complaints. So it's almost like a decorative vase. It's window dressing. And if you want to make an appointment for rehab bus, well, they will say that it's fully booked. So can you make some improvements to that? Well, I've had a lot of cases with me. So would you like to know the details? Even here on rehab bus, you have not been able to improve the service. You also talk about 11 premises or homes with 1,150 places for residential care. So what are the details? Because I'm really concerned. Because you might say that a particular developer has already donated this piece of land to Pokoi Hospital, all right, that has been widely accoladed too. But then in my tray, I have a case called Yen On Hospital. Alright, part of the site has been used to build a hospital, but then for the remaining part, it's been used to build luxurious flats. And another problem is, you also talk about elders going northward for their retirement. And in fact, you've already spelled out the crux of the matter. That's healthcare services. So the first point that I'd like to ask you is, for the $680 insurance coverage, what does that cover? Is it for minor illnesses or so on? So if it's just for minor illnesses, well, my mom also had this illness, and we had to arrange for special escort services at the border so that she could be transferred to the North District Hospital. So what will the $680 going to cover? And if you talk about certain subsidy or subvention, yes, but what's the coverage? And if you have to go all the way to Gaoyao, alright, that's really far away. Then my question for the administration is, why have you been working on the River Loop and also Qianhai? You've been opening up so many border checkpoints, and you're trying to engage in high-end technology, innovation and technology and so on. But then why are you not prepared to run certain residential care homes which would be affordable to the average elder? So have you thought about this? Because we have invested heavily in those places too. And also, for the purpose of making such investments, we have set up new border checkpoints, and we have spent a lot of money on that. And earlier on, this also became a big scandal. So that's in Yentang. Alright, so have you talked to Mr. Donald Zhang, the former Chief Executive, and the incumbent Chief Executive, Mr. C.Y. Leung? So for people who who would like to stay here for their retirement. So you are actually asking them to leave. So it's almost like going out of Egypt. But then after they have left the territory, what is going to happen to them? Are they going to fend for themselves? So which question would you like the Bureau Director to answer? I don't have high hope on him. All right, 3 questions have been put to you, Bureau Director. Yes, thank you. On the EC access taxis, all right, is a social enterprise. I understand that they are procuring more taxis in order to meet the demand. And for rehab bus, yes, we do have a fleet of rehab buses, and we have been increasing the fleet. And this year they are procuring more buses. But then we understand that there is a very high demand for that. So we have been giving them more injections, and we would like them to provide more diversified services. All right, Bureau Director, can you tell us this? So with regard to the coverage of such services, let's say if there are 10 disabled who would like to use the services, so how many of them will be able to get it? So what's the service or performance pledge? Well, we do have scheduled routes or scheduled services. Some also would be done by way of dial and ride. And for those making appointments, indeed, they have difficulties. But then for the scheduled services, of course, it's very simple. So long as you go to work and come back from work on a regular basis, that's okay. But then when people try to dial and ride, sometimes they have difficulties making the appointments. So for people having difficulty getting through the telephone and also having difficulty making the appointments, yes, we are going to help them. But then can it be like shopping centers? If I make 5 phone calls and still if I'm not able to get through, then you will give me 1 service or 1 ride for free. Can that be done? Or else what if I make 100 phone calls and still cannot get through? And if you are prepared to do that, if I am not able to get through after a number of phone calls, then you will be giving me a free ride. Can that be done? Let's say if Long Hair tried to do that, will you be prepared to offer that? That is a free ride, Madam Chen. All right, you're finished with your questioning. Okay, next, Mr. Peter Chang. Well, Para 10 is about the Guangdong scheme. All right, you have this fruit money, and yet you said that you would be looking into the feasibility of introducing the OALA. I think it's just the nomenclature. What has taken you so long? And then for Para 12 is about the rent and or the sitting tenant scheme. So why do you have to wait till 5 years? So for those who have been here for 4.5 years, they will not be eligible. So you're talking about the CCF program to provide rent allowance for CSSA recipients who have been tenants purchase scheme flat owners. And also for the rent allowance or rent assistance, well, for people or CSSA recipients living in private housing, the impact is very significant. And also under the CSSA, in calculating rent assistance, they are lagging behind. So have you considered how you can converge with that? You cannot ignore that. And so what is the interfacing going to be like? All right. I'll attempt to answer the questions, and then I'll ask Ms. Lau to answer the question on Social Security about the tenant purchase scheme and so on. All right, for the Guangdong scheme, as we know, it was only introduced in December last year, and so far, some 17,000 people have registered with us, and some 9,000 have been approved. So for the rest, there should be no problem because we're still processing their cases, and about 1,000 elders are frail and weak, and they have mobility problems. That's why they are not able to come here to attend the interviews. And we have also engaged the International Social Service to conduct the interviews on our behalf. So some 500 households have been interviewed. So we have adopted a user-friendly approach so that the elders do not have to travel all the way to Shangshui for the interview. The reason why we have to conduct the interview in a year's time, that's because this is after all a new scheme. So it was launched in October last year, and by the end of this year, it has been in place for a year, and it's time for us to review it. And also for the OALA, well, by the end of this year, we're talking about having it for more than a year. So for both schemes, we will have to review the operation to see if there are any problems before we decide whether or not we should regularize the OALA, because after all, OALA is a means tested scheme, and then for fruit money, after you've reached 70, there is no means test at all. And then if you're in Guangdong and if you get the fruit money or OAA after you have reached 70, then so long as you are alive, then there is no problem. But then for Guangdong, it's such a vast territory, and therefore there is no chance that we'll be able to visit each and every elder. But then for the OALA, since it's offered to the needy elders, that's why the mode of operation is different, and also we have to be more accountable. After all, we're using public money, and as the elder is on the mainland, sometimes we may not be able to track down on a lot of the details about their stay in Guangdong. But then we have to conduct a comprehensive review, because wherever possible we'd like to offer them more choices, so that many people might choose to retire in Guangdong. And then for the rest, I'll defer to the Assistant Director, Ms. Lau. Well, the second question is about the tenant purchase scheme. Why do we have to set it at more than 5 years? Because under the CSSA, buying homes is not a basic need, because the CSSA is there to take care of the basic needs of the applicants. And if they choose to buy a flat under the tenant purchase scheme, then under the current plan, after 5 years, they can sell it back to the housing authority or housing department. And after 5 years, they have no choice. They will have to continue to make the mortgage payment. Well, within 5 years, they have a choice, and if they have financial difficulty at any time, they can always revert back to a tenant, and we will also offer them rent assistance or rent allowance if they are eligible.
About CSSA recipients living in rented private housing, now the CCF will continue to provide subsidy to these households. There are views on how this subsidy should be calculated and what indicators it should be pegged to, and we also have a case under judicial review at the moment looking at the rent rental level. So we will closely monitor the situation, and we will also wait for the outcome of the judicial review before deciding our policy and what should be the level of rent. All right, my turn. I have several questions. The first is about universal retirement protection. Professor Nelson Chow once attended our meeting, and he would strive to submit the report in April. And recently, I heard that he could submit the report earlier. I don't know whether this is true or not. So I'm urging the administration to get prepared. If the report is ready by February, what will the administration do on retirement protection? The second question is on population. According to the consultation paper, there are hundreds of thousands of women whose potential can be unleashed. So we have more time today. I'd like the Secretary to tell me more about it. Two questions for the time being. Thank you. First, on universal retirement protection, the team led by Professor Nelson Chow has told me that by the end of May or early June, they will be able to submit the report. So about what you mentioned, this is the first time I heard it. I will go back and see if this is true, if the report can be submitted earlier or not. I suppose I have read some media reports. I need to verify this with Professor Chow and see if they could submit the report earlier. What I understand is by the middle of this year, latest, they should be able to give us a report. And whether this can be pushed forward, I need to get more information. And in fact, the consultation on population policy will end on the 23rd of February. And after the Chinese New Year, we will be reporting to the House Committee. Actually, after the Chinese New Year, Chief Secretary and myself will attend the House Committee's meeting. We have received 800 submissions, and we've also conducted a district consultation in Yaotong, etc. We are concerned about this issue, unleashing potential, so that women can join the workforce, so that for young people, for elderly people who retired at young age, whether they could rejoin the workforce, and whether childcare support is sufficient for women to rejoin the workforce. These are intertwined. If you want to generate more income, this is crucial so that women's situation can be achieved, so that women can go and work and look after their families at the same time. And we will continue to heed views, and Chief Secretary and myself will report progress to members at the House Committee meeting. The consultation period will end at 23rd of February. All right, Secretary, so the consultation ends at 23rd of February, and we are concerned about what the administration will do in the next step. As I mentioned in the article written by myself, this issue of unleashing the potential of women is not something new. It has been there for decades. In the past, in my generation, when we were in the 30s, we needed to look after our families and we needed to work. And back then, we were already talking about childcare services. So this problem remains. And in terms of quality and quantity, childcare services are far from sufficient. Working hours and number of centers available, even the locations locations of these service centers cannot meet our needs. And as for childcare, there are special cases. For example, you may have a system in place, but what about typhoon? What happens when typhoon strikes? And what about those working irregular hours? The importance attached to women in the labor force has been lowest as ever. And I heard views from the community in a restaurant that there aren't enough jobs, and they are not concerned about not being able to recruit people like dish-washing workers. And in Sampo Kong and the factory workers, we had those workers in the past. So my question for Secretary is this. This is not a new question raised by me. There have been views in the community on the age limit for childcare, etc. So following the usual practice, you don't need to answer me first. I'll allow members to ask a second round. Another 5 minutes. Dr. Fernando Zhang, thank you. Just now, Under Secretary Ms. Hui perhaps didn't hear my question last time. I wasn't talking about the award last time. Of course, I understand that there's a 10 times difference. Last time, I mentioned that for disabled professional athletes, they are not able to dedicate themselves fully in this area, because for grade 8 athletes they only get a monthly subsidy of 5,000, whereas for able bodies they get 20,000. So it's a difference of 4.3 times. So this is the difference. And about the Hong Kong Paralympians Fund, the fund is set up for the purpose of allowing these athletes to commit themselves fully in international competitions to for the honor of Hong Kong. However, they are unable to commit themselves full time. We don't even have one single disabled elite athletes, but we have several dozen able-bodied elite athletes. If you're seeking funding, you need to improve things. You may say that you can't improve everything overnight, but at least there should be a plan. You can't account for the difference. Do you understand my concern? This is the the first point. I thought that after going back you would rethink and give me something new, but in fact you've actually misunderstood my question, let alone giving me something new. And in your paper you talked about this year being the anniversary of the International Year of the Family, and the Family Council will be rolling out initiatives. And I once moved a motion in this council urging the administration to set up a commission on children, because there is no mechanism to factor in children's perspective in your policy formulation. And you say that you have the Family Council which will oversee all these matters. But in terms of important policy decisions, you mentioned that there will be an assessment from families' perspectives in policy formulation. But children are part of families, but very often they may not have may not be living in a happy family. Sometimes there might be domestic violence, or their parents might have deceased, or maybe they have been imprisoned, or some children might not be looked after by their relatives. They might be put in foster homes, and the well-being and the perspective of these children cannot be reflected in your policy decisions. So, Ms. Hui, you say that this will be taken up by the Family Council. Can you answer me and give me details how this can be achieved? Please allow her to reply first. Thank you, Dr. Chang, for your follow-up question. For able-bodied and disabled elite athletes and the difference, last time I also heard Dr. Zhang's concern. You cited an example just now on the difference between the awards given to these two groups. And I also explained that in 2009 and 2013, there have been substantial increases in the awards for disabled elite athletes, and we will regularly review the situation and see how we can enhance the benefits for disabled elite athletes. And we support them through various channels. The Home Affairs Bureau, for example, offers support via the Arts and Sports Development Fund, and there is also another program under the LCSD for training the talented athletes. And the Hong Kong Sports Institute also provides training for the disabled athletes, which cover subsidies for them and also a scholarship for them, so as to support their sports development. And on this basis, this fund is related to the Social Welfare Department. So on top of these forms of subsidies I mentioned, this also offer another subsidy to those athletes, and we will continue to review the situation regularly to enhance our support for the disabled athletes. As for the Family Council and Children's Welfare, Madam Chair, may I be permitted to elaborate on it? I feel that Dr. Zhang still have some questions on disabled athletes, so you can have a follow-up question on it. Under Secretary Ms. Hui again dodged my question. I asked about the huge difference. You failed to account for the difference, and because of this difference, disabled athletes are unable to commit themselves full-time to their sports training. And I'm saying that the amount of subsidy should be increased so that they can commit fully as full-time athletes. We're talking about international competitions. If they don't commit themselves as full-time athletes, it's difficult to compete in those events. I am sure you are aware of that as well. And disabled athletes are already disadvantaged, and they receive the subsidy far less than able-bodied athletes. Even if you can't change it overnight, you should have a plan to achieve a balance. There's no reason to suggest that because they're disabled they should receive less subsidy. They should receive more. I want to reiterate that the difference doesn't lie in the fact that they are physically, their physical abilities are different. We set the level of support and subsidy based on the level of competition they are taking part in. And again, in 2009 and 2013, the level has been increased twice, and we need to take a comprehensive approach in reviewing the support for disabled athletes. Even if you raise the level, it's just $5,000 a month now. It can't even cover living expenses or meal expenses even. If we are really committed to grooming disabled athletes, at least for grade 8 able-bodied athletes, they receive $20,000 a month as subsidy. So the level should be raised to such a level so that they can pay for their expenses. Now let me also chip in. There shouldn't be any difference between their status being able or disabled. And Undersecretary, you were not able to answer the question. They need to receive subsidies enough to cover their living expenses and commit themselves fully as athletes. We would like to have a more detailed discussion. So, Undersecretary, what are the problems?
As I said, for different sports events, we have different views with regard to the support for the disabled athletes. Well, since 2007, the Hong Kong Sports College has been increasing the overall sports subsidy for them, and the SWD would also offer this additional living subsidy for the disabled athletes. And under these circumstances, we have also been reviewing the situation on a regular basis. We have taken on board the suggestion by Dr. Fernando Jiang, and we'll see how we can take the matter forward by providing better support for our disabled athletes. So are you referring to the disability allowance or the CSSA? No. That's about the Paralympian fund. So can you tell us exactly how much they'll get as a living subsidy? Well, for individuals, they vary because even for elite athletes, there are different grades, and everybody will be getting about 20,000 plus. Well, when will the review be conducted? When will the review be done? Undersecretary, last time the subsidy was raised in 2003, and then the next was in 2009 and 2013. We hope that we'll be able to do another review shortly after that. So there will be some time to go before the next review. I hope that you can pay heed to this, because if we want to have an all-round development, then everybody will need to have greater support. Next, Gary Fan. Thank you. I'd like to ask about the Guangdong scheme. Para 17 in the paper says that the administration will be buying places from the Hong Kong Jockey Club, Shenzhen Society for Rehabilitation, Yihong Heights, and all right, as Shenzhen is close to the North District Hospital, and therefore we heard that the scheme should be feasible. So my question for the Bureau Director is that according to the Society for Rehabilitation, well, for this particular institution in 2012-13, the utilization rate was only 35.3%, and out of these 350 places, on average about 124 places have been taken up. In other words, it's obvious that Hong Kong elders, when it comes to the healthcare system on the mainland, about their mistrust and also because of their social networking and also the accessibility by their relatives and friends and so on. Because it's remotely located, not many people are interested in going into the RCHE on the mainland in Shenzhen. So do you have specific measures so that in the foreseeable future, more elders would be like what the Bureau Director say, that they will have an additional choice so that they can move to Shenzhen? And in para 17, you're actually talking about an even farther away home in Zhaoqing. So on what basis have you made that suggestion? Bureau Director, thank you for your question. As the paper said, this is a pilot scheme, and in 2 years' time, we're going to review it. And there are many challenges in the interim. And as you said, the biggest problem is the support for medical care, because in the past, when they had difficulty recruiting or attracting elders to stay there, that's because of the location and also the healthcare services available. Many elders are not having any confidence in that, and many organizations would also come up with appropriate measures to address the concerns of the elders. In answering an earlier question, I told the members that Yantian is relatively close to Hong Kong, because from Yantian to the North District Hospital, including clearance of immigration and so on, is about an hour's journey. So even if they are in a hurry, they should be able to travel back to the North District Hospital. And for follow-up consultation, that's once every 3 or 4 months, then the institution or the home can also arrange for escort buses to take them all the way to the border checkpoint, because for follow-up consultation, some arrangements will have to be put in place. And they also have resident doctors and medical staff at the RCHE. And in terms of support facilities, if family members want to visit them, then there are scheduled buses every day at the Sha Tao Kok border checkpoint, and once you cross the boundary, you'll be able to take those buses. In fact, it's about 10-20 minutes drive from the BCP if you are talking about Xinwei Sha, and it's very close to Yantian Port. And also, even if you travel by taxi, you're just talking about a 10+ minute drive. And then for Zhaoqing, we are still negotiating the package, and for the support measures that will be available in Zhaoqing, they also have medical staff who are resident in the home, and they have doctors and so on. But then not far away from the home, we also have this Gaoyao local hospital. Is a people's hospital. It's a comprehensive or general hospital, because in Gaoyao we also have hundreds of thousands of residents, and the arrangement is like this. In the past, they've been doing this already. Alright, they can take out an insurance package, that is a medical insurance, and that would provide for some basic coverage. And if you have to undergo surgical operation, of course, if you are not sure about this, you can always come back for the elective surgery. But then after all, it's a general hospital. It's a sizable hospital with full services. I've also visited the hospital to look at their equipment, facilities and so on. But then here we say that the most important thing is to allow the elders and their families to make the choice. We are not encouraging them. We are not saying that you should go there, or that we are exporting our elders across the boundary. That's not true. In fact, we respect them. We give them one more choice, and if they think that it's quite nice, and in any case, I'd like to go and retire there, but so long as you're in Hong Kong, and if we believe that you're eligible for a subsidized place in the centrally run homes, so that after you've been assessed, thinking that and if the assessment says that you are eligible and you should go into one of the central list homes, then you would be eligible. And after 2 years, we'll be reviewing this pilot scheme. All right. If that is the case, then would it be that after you have started the Society for Rehabilitation Home in Shenzhen, and after you have come up with all the measures, and if the utilization rate has gone up, then you'll be extending this to Zhaoqing? So number one, that would be more cost effective, and number two, you would at least be able to tell what's the response from the elders. All right, I have to put it this way, because if you look at the background to these two homes, well, actually for the Zhaoqing home, the history is longer than that for Yantian. And in Yantian, the area is very big, and if you've been there, you'd know that it's a very big site, and is very well located with very good air quality. And on this occasion, well, the birthplace scheme It's not like what we do in Hong Kong. For a particular home, we'll just buy 20, 40 places. No, that's not true. The approach here is that, alright, if elders choose to go there, then we'll buy that place for this particular elder. Do you know what I mean? So we are not buying all the places in advance. So long as it's, after it's been taken up by an elder, so there is no waste whatsoever of any public money. So it's a very targeted approach. So we are not buying 30, 100 places in advance. Well, if just one elder has raised his hand saying that he'd like to go there, then we'll buy that place for him. That's the approach. Next, Alan Leung. Thank you, Madam Chair. I'd like to follow up on this. Just now, Gary Fan asked a question, and I'd like to take it forward. All right, you said that only where somebody has indicated interest would you be buying a place on his behalf. So do you have a queue, so to speak, for going into these RCHEs? So do you have a list of elders who are interested in these homes? Have you conducted any survey? And according to your estimate, how many people will say yes and go? Actually, a few years ago, we did a very rough survey. We did a rough questionnaire on the elders. We asked them if they are interested in going north, and in fact, the number was not great. Yes, and there was about 4%. And 4% of the respondents said that if healthcare services are okay, then they would be prepared to go. And if you're talking about 20,000 in a queue, then you're talking about several hundred. And in the Yantian home, we are talking about 100 plus. And then Zhaoqing together, we are actually talking about 300 to 400 places. And if indeed these elders are interested, if indeed those who said they would be interested indeed would go, then we are having some 300, 400 places available. All right, if that's the case, then if the first elder were to move into Yantian, that is the Hong Kong Jockey Club, Shenzhen Society for Rehabilitation, Yihong Heights, then when can that take place? Well, in the second quarter of this year, we'll be informing these elders who are on the waiting list. So the 20,000 plus on the list will be informed. We'll give them the details so that they will have a better idea as to what the scheme is all about. And if you want to come back to Hong Kong, what they're expected to do, because their families and friends will have to know it. And then after they have been told, then in the third quarter, they can start moving in. So starting from June onwards, they will be able to move in. Next, Madam Chair, I'd like to ask this because all along I have difficulty understanding this. Well, for the $2 travel scheme for the elders and eligible disabled persons, well, how come you will have to wait till the first quarter next year before it can be extended to GMBs, and it can only be done in phases? What is the difficulty? Can you tell us more? Mr. Leung, you asked a very good question because I am also very keen on this. I hope to be able to do it as soon as possible, but some of the issues are more complicated than expected. That's why, number one, we have to make the commitment so that the public would know that we do have the commitment and we are trying to do that. The reason why it has to be done in phases, that's because, well, as far as the MTRCL is concerned, and also the 4 franchise bus operators, and then for ferries, it's relatively simple. Number one, for MTRCL, we only have one counterpart, that is the MTRCL. We only have one operator running the services. And then for the 4 franchise bus operators, we're talking about 4 companies, we're talking about several thousand buses, and for the ferry services we only have about 10 plus routes. But then for GMBs, we're talking about some 3,000 GMBs, and we have more than 140 operators, and there are 400 plus routes. So the first challenge is that there are different modes of operation. Some would be run by companies, some would be run by the individuals, some would be run by partnerships, and then even the driver himself is a boss, and some would have this score points. So there is no economy of scale. So we are using public money, and then the current mode of operation is that, all right, for the MTRCL, they would, after you pay the $2 fare, the rest will be picked up by the administration. So for the GMBs, we have to have a very clear clearance or settlement mechanism, because we have to be accountable. After all, we are using public funds. And number two, technically it's also very difficult because some allow for the use of autobus cards, and then you will have to have a platform for the clearance and settlement. And number three, it's not just about elders, because about 130,000 disabled would also be eligible under the scheme. And we do have autobus readers on board of minibuses, but then they they do not have readers for disabled for the card for the disabled. So we will have to start from scratch as far as the hardware and software are concerned. And then for some minibuses, they are able to do it. Others are not mature enough to do it. So that would be more mechanical. We would like to be more flexible. And the TD will take the initiative because after all, is the department responsible for that. And the transport department is now looking into this in depth with the sector. And the sector has also promised that they would be prepared to do that in stages, because some of them might have misgivings about allowing you to have a check on their books, because they are running the company as proprietary owners and they do not want you to take a look at their accounts. Because well, all you need is to use your Octopus card, but then how do we check the accounts? We have to be accountable, because when the FC asks us how we are going to keep an eye on this, well, we might have difficulty, but then we do have every intention of doing this, and if we are able to do it earlier, of course, that would be nice, and then whichever route is ready, we'll do it first. I hope that you can expedite it, because for GMBs, because of this, some of the elders will find it more difficult to move around if they are not able to take the GMBs, because some of these areas are not accessible by buses. So I hope that you can do it as soon as possible. Yes, absolutely, I agree with you. And then for the NT in the rural areas, they will have to rely on GMBs, and many villages are only accessible by GMBs, and many elders would also prefer to take GMBs because it's more stable and easier to ride. All right, I'd like to put in this word, Bureau Director. Well, some Kaifongs or residents are finding it very confusing, because once you made the announcement, they thought that that would be ready. But then when I tell them that you will have to wait till the next year, then they would be extremely surprised. So are they going to increase CSS, say, Madam Chen? And then I told them that, well, it was announced last year. So they thought that after the announcement is made, it would come into effect immediately. But then if they have to wait for another year or so, then they would be very confused. I understand that there are technical difficulties, but then are there any reasons why you are delaying us for such a long time?
Well, Madam Chair, as I mentioned, there are technical problems, and we have over 100 operators. Unlike MTRC, which is only one organization, we have a working group on this. And Madam Chair, I want to clarify this. For CSSA and fruit money, in fact, starting from the 1st of February, this will be adjusted. And even starting today, the deposits into accounts have been adjusted. Yes, but the general public believe that it's something in this policy address. And these questions were not asked by the elderly people, but young people. So their awareness is not high. We are reflecting views of the community. In fact, for policies announced today, they need to wait for another year for its implementation. I understand the technical problems, but sometimes even for public works, we ask why they're taking so long. And even for social welfare policies, we also need to ask why they're waiting so long. You need to rethink. Next, Dr. Kwokaki. Madam Chair, to follow up on the question on children, for the for para 55, the injection into the Partnership Fund for the Disadvantaged, PFD, it's dedicated to provide more after-school learning, etc. Can you tell me more details? What will be the target group and how can they be assisted? The other point is also about disadvantaged group, about the integrated Center for Mental Well-being across all 18 districts. In 2014, more resources will be allocated. My question is, by the end of the year, or the end of the final financial year, what can be done in terms of the hostels for discharged patients? What more will be done? Well, I defer to my colleague to answer on the question on rehabilitation. About the PDF Partnership Fund for the disadvantaged. Now, we are proposing to provide after-school learning and after-school care so that the potential of parents can be unleashed, and through the injection into this fund, and this is actually a matching fund for a social welfare program up to 2 million. Now this is about after-school care, and the social welfare department pays 4 million. We would like to invite the participation from the business sector. In fact, without offering any money, the business sector has already implemented a number of successful programs. One is called one program involves 10 under disadvantaged secondary schools. It's a program called Yes We Can to support the setting up of schools. The other program is called 333 School Learning or 333 Learning Program. The purpose is to train students with special educational needs and underprivileged children. And I think we should promote it at the district level. Say in Chiwanshan, the school may be used as a base, and all the primary school children, eligible ones, on a voluntary basis, will be taken onto coach and conveyed to that school base, and they will be taught basic skills on also general education and core values, and the coach would also take them home. I think this is a very touching program. We should do more. Working parents don't need to pick up their children after school because coaches can take them home. But we need resources. We need to pay for university students, teachers, tutors. Now the matching fund, that's the nature of the fund. We'd like to encourage the business sector to do more. Madam Chair, before you finish your answer, I'd like to supplement. For underprivileged children, you talked about Chiwanshan. What about other districts? Let me make it clearer. Tin Shui Wai, North District, and Tung Chung, we all know that these are districts with more underprivileged children. And are these areas covered? Dr. Kwok? We don't have resources to initiate the programs yet. We rely on the initiation from the business sector. We talk about a Yes We Can, and also a 333 in Sham Shui Po and also in Chiwanshan, and we also like to cover Tung Chung as well. And once we have funding approval from the Finance Committee, we will be able to liaise with the business sector proactively, so that we pay $1, they pay $1, and we have collaboration between business sector and the government. And those grassroots families can really stand to benefit. And perhaps Mr. Fong, Assistant Director, can talk about rehabilitation. Once mental patients are discharged from hospitals, 2 teams of professionals will take up the case. One case managers from hospital authority. For discharged patients, they will follow up on their drug compliance, etc. ICCMW, that's another team, the Integrated Center for Mental Well-being. They may not take up all cases of discharged patients, depending on what social support those patients need and their own circumstances. As of September 2013, from 2012, we have dealt with 33,000 cases. And after this financial year, how many more cases can we take up? It depends on the budget approved. And we learned from frontline staff that for ICCMW, the center doesn't only serve mental patients, but people suspected to have mental conditions, and there are some 60 to 70 such cases. With funding approval, I believe our pressure can be alleviated. I think so far we can't come up with a concrete figure, but I hope the funding can help them. I don't quite understand. For the needy, you must have a figure in mind, 33,000. For those requiring long-term care, or there are around 200,000 mental patients. So 33,000 is 1/6. Is it sufficient, or are you saying that there are some 33,000 more waiting, and yet you don't have resources? Do you have those figures? Secretary, I'll defer to Mr. Fong. Now, on ICCMW, as you mentioned, we don't only deal with certified mental patients. We also have suspected cases, and that covers a wide spectrum. And we're dealing with many cases which are referral from the community and other departments, say housing department or the police. And we've introduced this service for 3 years only. We are collecting data at the moment. If we are to meet the community needs, how much more resources or manpower do we need? We are doing some analysis, and in due course, once the program is rolled out full steam, we will be able to give you a more concrete answer. In the long run, for those requiring social support services, for example, those wanting to participate in certain activities or the support of social workers, the ICCMW staff will be able to help. Thank you. Second round, Mr. Chen Kwok-chi. Thank you, Madam Chair. Para 14 mentions the Elderly Services Program Plan. And the Elderly Commission is to coordinate the formulation of this plan. I don't know how many government departments will be involved. If this is just a program plan under the Labor and Welfare Bureau, I don't think it's wide enough, because with more elderly people in our aging population, we should look at not only social welfare needs but also housing needs, their contribution to society, their physical and mental well-being, and other government departments should be involved. So is the program plan similar to, say, the rehabilitation plan, or is it closer to an elderly policy? And if the whole process takes 2 years, will you be urging the Elderly Commission to extensively consult users, stakeholders, and the community? Secondly, we mentioned Yantian and Zhaoqing, and we may be buying places, and you mentioned that places can be bought individually whenever requests are made. But do you have a cap in terms of the number of places? Please let us know. And Para 19 mentions that within this term, still 3 years or more left to go, 5,000 additional residential care places will be provided. But some 3,000 will be vouchers. So excluding that, what about the remaining 2,000? How has this figure come by? We don't understand. If you aren't able to explain it today, can you give us paper later? And also another question on Para 28. In 2010, October, you launched the 4-year pilot board play scheme for private residential care homes for PWDs, and the percentage of subsidized places will be raised from 55% to 70%. This is a good initiative for RCHDs to do their calculations, but in terms of number of places, will they be increased or will they be maintained at the 2010 level? And how many places have been bought? 4 questions. Secretary. For the Elderly Services Program plan, indeed, is focused on elderly services under the purview of Labour and Welfare Bureau. We're not talking about healthcare or housing because this will be another plan outside the scope of the Elderly Commission. We note your concern, and we will be discussing with, say, Food and Health Bureau on healthcare. We do have communications, and also the Steering Committee on Population Policy, which is a high-level committee overseeing and coordinating things as a whole. As for finishing this task within 2 years, will the Elderly Commission conduct consultation? Definitely. They may also commission consultants to conduct studies. Yes, the Elderly Commission may commission consultants to conduct in-depth studies. A cap, whether there is a cap on the number of places in Yantian, definitely there will be, because altogether only some 400 places are available. But in Yantian, the site is very large, expansion is possible. This cannot happen overnight, but this is possible. On buying places, we'll look at the actual needs. We won't buy those places and pay beforehand before inviting elderly people to move there. This is not pragmatic, and this is a pilot scheme. The organization is very flexible in providing services in Yantian so that it can be done on an accountable basis in order to achieve cost effectiveness. 5,000 additional places, apart from 3,000 through the vouchers. For remaining 2,000 places, we're going to provide some 1,200 in 2015-16. We have done all the planning we needed. We have the site, we have the funding, and once all the things are completed, they can start to provide services. The remaining places will be obtained through the board play scheme, and we're confident in achieving this target. And I talked about 11 sites. They are not in our control, but once they're available, they will be ready for providing service. And for the home in Lam Tay, some preliminary facilities may be provided in 2015.
And 2,000 places will be available. And then for the RCHDs, in fact, some 70% of that is underway. Yes, for the RCHD, well, the board play scheme, well, in October 2010, under the Lotteries Fund, we launched the 4-year program, and it should expire by the end of September this year. And as of now, we have already bought 245 places, and our target was 300. But then just recently, we have conducted the second round of the tendering exercise, and we have already selected certain places. We haven't yet announced the result, but then we are rather optimistic that there should be over 300 places in total by September this year. And you also talk about the regularization of this program. We hope that we'll be able to buy more than the target number, but then it depends. So whether or not we are able to buy those places, because it depends on the quality of the place in the private home. And also when we buy places, we also have to be more stringent on the manning ratio, and also the specification, and also the per person space would also have to be higher. And therefore, we have been encouraging private homes to make improvements so that they'll be able to upgrade the service in order to meet our requirement under the board play scheme. Next, Tim Yu Chong. Yes, some questions might have been answered by the Bureau Director already, but then also concerned about them. Number one, in the policy address, you talk about this planning elderly services program, because I understand that in that area, you need to have planning. You have the 5-year program, and afterwards, you'll be able to implement the plan step by step. And there are local issues and site problems, and also manpower preparation. So you have this preparing elderly services program plan, and then in the policy address you made the announcement and you said that additional manpower would be given to the elderly commission in order to come up with this program plan. And I hope that you'll be able to achieve what I initially expected, that is, you would indeed come up with a plan with figures and timetable and all the details, so that we will know exactly what's going to happen in the next few years. Another question that I'd like to ask about is LIVA, the low-income working family allowance, because last year when we discussed the WITS, initially we were told that the household would be the basis for application, but then afterwards we found out that it's not going to work, because amongst the members sometimes they do not want each other to know their income. That's why in the end we decided to go for the dual track approach. So on this program, are we going to have similar situations? Well, yes, the Bureau Director, you may not think it's a problem, or are you saying that, all right, take it or leave it and nothing can be done about it? But then have you learned from past experience? That's the second point. And third, well, for the two mainland homes, I've been there both. I've been to both homes. One is in Yantian and one is in Zhaoqing, and both have very nice environment. But then, regrettably, since their opening, they have not been very popular. And you might attribute this to the lack of healthcare services, or this is, after all, an unfamiliar territory, and some elders do not want to be separated from their families. If nothing changes, then the utilization rate might still be low. But then I still encourage this approach, because after all, elders will find it easier to make a decision with this additional choice. At least the financial burden can be eased. But then for the other problems, they will continue, like healthcare services and separation from their own family and so on. In any case, we are not forcing elders to go there. We are just giving them one more choice. We hope that this approach will provide greater convenience to the elders so that they can consider this more positively. So I think this is something good. So 2 questions and 1 comment. All right. Thank you, Mr. Tam. First, on preparing the elderly services program plan, we hope to adopt some new thinking, because we have to be visionary, and we think that it's time for us to do something about it. We believe that this is an appropriate time for us to do it, because we do have this special scheme on the land use, and we have 60 projects and 17,000 places, and out of the 17,000, some 9,000 would be for the elders. So we do have the hardware for us to kickstart the program. All right, with the hardware, well, where can you identify the premises? Now we have several dozen projects in place, and we understand that they are there already and they will be implemented. So land is no longer a problem. That's why on the 21st I will be going to the FC to apply for $10 billion using government money, so that we can inject that into the lotteries fund, is to show government's commitment on this. Because this is a welfare infrastructure project and we have taken a major step forward. That's why it's time for us to adopt this two-pronged approach, both hardware and software. We are not just talking about a 5-year time frame. It might be 10 years, because we're talking about increase in manpower and so on. That's why the committee will have to do a very detailed job, and in 2 years, I hope that they'll be able to come up with a full package with all the indicators and directions and so on. And then on LIVA, as to whether or not a dual-track approach would be adopted. Well, this is very different from WITS, because we're talking about individuals' employment. But then on this occasion, there is no individual whatsoever, because we're talking about the household-based approach. So it will be tied with employment. We encourage self-reliance. What's most important is we'd like to provide support to children in the grassroots sector, because childhood or children poverty is very high, is 19.9%, and after a lot of efforts, we have only been able to suppress it so that it has come down to 15.5%, and we are talking about some 50,000 children who might be able to be lifted out of poverty under the scheme. So there is no question of having a dual-track approach or one-track approach. So we have to do the calculation, and this morning we had a very lengthy discussion because we have to rationalize everything on the definition of working hours and so on. We have to reach a consensus on all of those, and that will take some time so that we can come up with a full package, and then we'll come back again to give you all the details before we go to the FC for funding. Last but not least, on the mainland homes, yes, one in Yantian and one in Zhaoqing. Indeed, so they are specifically designed for Hong Kong elders, and yet they have not been able to attract many elders from Hong Kong. This is really regrettable. That's why we are actually giving the elders this choice, and we also have to reassure the families that this is going to work, because after all, what they are most concerned about is healthcare services. And then in Yantian, well, after they have connected with North District Hospital, family members will have greater confidence. And then for the Zhaoqing home and Gaoyao, we hope that the Gaoyao People's Hospital will at least be able to provide some primary support, so that at least if the conditions are not too acute, then they can go to that hospital first. So we try to do it step by step, and then we give more choices to the elders. Next, Leung Chi-hong asking for the first time. Oh, Leung Chi-chung. Alright, just now the Bureau Director responded to a question in relation to the two mainland homes. I'm not going to further dwell on that. But on homes for the elders, in particular in the case of Hong Kong, for elderly homes, yes, there is a shortfall in terms of places. Whether we're talking about places in the public or private sector, they are also suffering from a shortage of manpower. I think everybody in the sector knows about this. In the policy address, the Chief Executive said that there would be some training for the younger generation. About 1,000 places would be available. But then, according to the current approach by the administration, in particular, the policy address said that more RCHEs will be built, and under the Port Oil project, some 2,000 places will be provided. Alright, we are already suffering from an acute shortage of manpower, and if you're going to provide more places in the future, then what plans are in place to ensure that we will have sufficient manpower upon the commissioning of these new homes, so that they will be adequately served? I am concerned that it's going to be like the hospitals right now. Alright, for Port Oil Hospital, it's been completed for a few years, and still some of the beds have not yet been commissioned. That's because we have a shortage of doctors and nurses. So even if the beds are there, well, yes, they have some 600 hospital beds, and only 400 have been commissioned. So in the future, after the homes have been completed, after the places are ready, if you do not have enough medical staff to serve those homes, then some of these places cannot be commissioned, or elders will not be able to move in because of the shortage of manpower. So that's going to be a big problem. Alright, Bureau Director, you just said that you're working on both hardware and software. Alright, we all know that you've identified many sites, but then for software, indeed, I do not have any confidence at all, because for the Port Oil project, you have 2,000 places. Would they be manned by sufficient manpower? All right, Bureau Director, you're also responsible for labor. So can you reassure us that you have every confidence that they will be served by sufficient manpower? Thank you for your question. This is indeed a challenge. We have to rise up to that, because with the hardware, if there is no software, it cannot be done. That's why we have to start to train up more people. In particular, the younger generation will have to be attracted to join the profession, because in the healthcare industry, there is a an acute demand for manpower because with an aging population, this is going to be a thriving business. But then many younger people are not encouraged to join. And we have to allow them to see this career prospect. So it's not just about the next 5-10 years. You do have this career ladder that they can climb up. As you can see from the paper, since last September, we introduced this pilot scheme, and the initial response has been very well. That's why in the policy address, we have set aside some 1,000 places in the next few years so that we can continue with the program. And there are different objectives. We are telling the students that this is not about frontline care. So you can also move up the ladder and become one of the management staff. Yes, I would very much like to see it realized. But then 1,000 places. But then in the future, even if you have 10,000 places, in 5 to 10 years' time, you're going to have 10,000 additional places. So how are you able to train up enough people for those places? Yes, we have 1,000 places, but then when necessary, as I said, we did have a scheme. We are trying that out. And we've been telling the young people that we can expand that program. We'll be fighting for resources for that. The most important thing is their willingness to join. Because if you have the money without the people, it's not going to work. That's why we have to do it within the year. We'll be stepping up publicity. We have to tell them the success stories. And also we have this pilot program for younger people to join the profession, and we'll be encouraging more new blood to join the profession, and also for the new arrivals, even if they are middle-aged, through the BTC, and also the employee retraining board. Some of the housewives or women, and even for the South Asians, some of these would also be suitable for them. And therefore, we'd like to attract more people from different sectors. If they are interested, then we will offer them more training so that they can join the profession early. And then with time, we hope that we'll be able to catch up with the manpower need. But then I agree, it's not just about the carers. The nurses are also in hot demand, and that's why we are organizing training courses for enrolled nurses, and the response has been very good, and they will have to make a commitment of staying in the profession for 2 more years. So after graduation, they will have a job waiting for them. Alright, if there are no further members in the first round, then we will move on to the second round, and it's my turn. And just now I asked a question and the Bureau Director did not manage to answer the question. So it's about the potential manpower. That is the hundreds of thousands of women whose manpower could be unleashed. Alright, if you're able to do it in a coordinated manner, then more people will be able to come out to work, and they will also be prepared to give birth to more children. In Singapore, they've conducted the survey, and many people are reluctant to give birth, but then in Scandinavia, they are able to do that.
The policies might be similar, but they provide very comprehensive supporting measures. So that's a question for you, Secretary. Secondly, also another question raised by some members. And I agree, I have to ask this. Secretary, you have worked hard, and for 5,000 places committed, you have provided 3,000 for the remaining 2,000. You have identified sites, etc. But you need to expedite progress, because for the dozens of organizations, they might need to go through redevelopment projects to supply those places. As Tam Yu Chung mentioned, it seems that there is something to look forward to. Something would be done by the Elderly Commission. But sometimes the administration cannot handle everything. The Shek Chai Lang is a classic example. And some 1,000 elderly people would have to be vacated. So what should happen then? So, Secretary, this is my feeling. In terms of elderly services, we have sticking plaster solutions, and there will be a 5-year plan or a 10-year plan. This is a good initiative, but it's not easy. The government should stay united. Mr. Cheung, you may be working hard, but other bureaus might be working against you, and this will give you a hard time. So please report back to us so we can offer you our views. Just now, Mr. Tam Yu Chung also asked a question report back to us as soon as possible for us to give you our views, and also unleashing women's potential. Thank you. On unleashing women's potential in the workforce, we will have proper complementary measures, childcare, elderly care. Sometimes women may need to take care of children as well as elderly, and we will enhance our elderly or childcare services, daycare centers, and also daytime childcare service. These centers will extend their opening hours so that women can work longer without having to worry about their children wandering in the street. What about shuttle buses or coaches for women? Just like in the past, there were such coaches for women which take them to factories to work. The consultation on population policy would end on the 23rd of February. Some views have been given to us, including the one you mentioned, that the administration should remain flexible. There should be more support in order to attract them to join the workforce. Some may be living in remote areas, and some mentioned whether for hotel housekeeping services, whether these services can concentrate on a certain period so that women can work part-time. And we need employers in the market to adopt an open mind. In fact, even employers need to make changes. They need to adopt a more flexible attitude. And there are also other initiatives, arrangement for transport, offering more part-time jobs. Instead of asking them to sit there for 8 hours, they can sit for 4 hours or 6 hours. These are for the employer's consideration. Another point is, well, Secretary, before talking about elderly services, may I follow up on the point you mentioned? You say that it is being studied at the moment. Please give us a picture about coaches for workers and other flexible ideas. In terms of the 11 sites, can childcare services be provided at those sites so that elderly care as well as childcare can be put under one roof? Please give us a comprehensive plan so that we can give you advice. Yes, in due course. For example, for the special scheme to use privately owned sites for welfare purposes, we have several 10 organizations, and this is a start from scratch, and we're considering whether we can include the element of child care. And at the same time, we need to consider how to strike a balance, whether services for the elderly or the disabled will be reduced as a result of including child care. We need to have a comprehensive plan for women to feel comfortable at work. And also for the other point you mentioned, the point is complex. Many organizations have not undergone redevelopment projects. They have to go through statutory procedures for rezoning, change of land use, etc. And we have a dedicated staff to help them. Of course, they need to follow procedures, but we'll try to compress the process so that they don't need to grope along the way. The whole idea is for them to complete the development as soon as possible for service rollout. So please give us more information later. Yes, we'll report back to the panel in due course. Third round, Dr. Fernando Zhang. Thank you, Madam Chair. You'll be speaking for less than 5 minutes. I have 5 questions. You can only speak up to 3 minutes. The meeting is scheduled to end at 4:30, right? I have 2 members waiting to ask questions in the first round, so 4 minutes. Now on transport for the disabled, barrier-free access transport. Now on rehab bus, there are 13 to 14,000 cases in which rehab bus turned down the service request. This shows how serious the problem is, and out of the 13,000 cases, around 7,000 cases involved follow-up medical appointments. And this is disappointing because for the disabled, they need to attend follow-up treatment, and yet they can't get rehab bus service. So we need to think about it. For GMBs, which will be covered in the $2 fare scheme, because this is a good initiative, because many GMBs travel to and from hospitals, and still there are many obstacles. For example, for QE Hospital, we thought it's very accessible, but in fact it is not the case for the disabled, let alone Princess Margaret Hospital or the orthodontic or the Sandy Bay Hospital. And GMBs are not barrier-free. So, Secretary, you need to think about it. It might be outside the scope of Labour and Welfare Bureau. You may need to work with Hospital Authority and the Transport Department, and may have to do with the Transport and Housing Bureau as well. So that's an issue. The other point is in the policy address it mentions 66,000 preschool training places. So can you elaborate on these 6,200 places? What services will be covered? There are 3 kinds, and I'd like to know more about the service involved. And on low-income working family allowance, the disabled has been ignored. And what about the disability allowance? You say that it's undergoing review. What is the timetable? When are you going to submit a report to review matters including the amount? We have no idea. As for the Elderly Services Program Plan, you're seeking funding approval for creation of posts, and we could endorse it or we could not endorse it. But we need to know the details of the program plan. Is it just about elderly services? Is it about all elderly services? Are you talking about a 5-year plan for all these services? Are there any service demand projection? Any land or manpower resources in support? Otherwise, I find it problematic. Rehabilitation program plan. It was done in the past. It has been suspended for 5 or 6 years. The RPP, the latest one, was made in 2007, and it's been 6 years. Will it be formulated again? And finally, for carers allowance for the elderly, this carers for the disabled should also be covered. In short, I agree that for rehab bus service, we need to work with the Hospital Authority and the Transport and Housing Bureau because they are involved. We don't just only serve people with disabilities. Even elderly people with the aging population, more elderly people may need to take this kind of transport. For some 6,000 places, we do have the breakdown in the paper explaining very carefully. For 6,200 places, some 2,016 places are for daycare, and also it's 2,713 residential care. Please give us the breakdown of the meeting in writing. As for the review of the disability allowance is being conducted, and the PS is chairing an interdepartmental group. They're working at full steam. They have commissioned the Hong Kong U to conduct a consultancy study which looks at other jurisdictions to see whether we can draw reference from overseas experience, and the report will be submitted to us on life insurance and for us to formulate our way forward. Elderly Services Program Plan. Dr. Zhang, we don't just look at hardware, we consider hardware together with software. For the creation of posts in the paper, we urge members to support us. For AOSGC posts, they don't just work on the Elderly Services Program Plan. They also take up the pilot scheme on residential care services, voucher scheme. And only few staff are involved in the moment, and the AOSGC will look at the two things, not just the program plan, but also the voucher scheme. So we don't just indiscriminately create posts. I urge members to support us. As for the RBP, Rehabilitation Program Plan, we would like to focus our effort on elderly services first. And we'll at the same time look at long-term care issue, and any rehabilitation-related issues will also be considered. Thank you. Second round, Mr. Tam Yu-jung. 3 questions. First, on old age living allowance, over 410,000 elderly people will benefit, and the administration will review the arrangement before the end of this year. In the review, will you also consider relaxing the income and asset limit? When the OALA was set up, we mentioned that elderly people would like to save up for emergencies, so they could easily exceed the asset limit. The administration said that the level would be adjusted according to the inflation, and this year it has been inflated, and it's just a change of several percent based on the change in inflation. The second question is about the Guangdong scheme. Since introduction last October, the scheme has received good response. As of the end of last year, 16,700 elderly people have applied, and 7,000 applicants have been receiving the allowance. About 50% of the cases are still being processed. Does it mean that they're not eligible, or they haven't provided sufficient information, or that the procedure haven't been completed? The chief executive also indicated that his wish to extend the OALA to Guangdong province. The feasibility would look into what is meant by would seriously consider the. And what about feasibility? Is it technically feasible? If fruit money is feasible, then what makes the OALA not feasible at the moment?
First, on the OALA, well, we'll be looking into that by the end of this year. Indeed, we also will be looking at whether or not the income and asset limit can be relaxed, because since the introduction early this year, it has been relaxed already in line with inflation. For a singleton elder is 193,000, and now is been increased by $9,000 to over 200,000. And of course, we will see if there is any further room for upward adjustment other than adjustment for inflation. And then for the Guangdong program, yes, it's been very well received. We have 17,000 plus applications, but then we do need time to do the interview. Some 8,000 have been approved, so we have some 8,800, 8,900 that have been approved, and we've been paying the money. And then for the 1,000 plus elders, because they have health problems or they have mobility problems, and then they will have to give us medical reports, and we will have to conduct the interview through the International Social Service. We have visited several hundred, and we went as far as Henan, Qingyuan, and after visiting them, most of them have obtain approval for the release of money, but then it will take time for us to complete the interviews. We hope to be able to do that in the next 2 months. So it's not just about this, but then whenever the approval is made, if you've applied for that before October, then we'll be able to date it back to October, so they will not be losing any money. But then we have to conduct the interview, and after the interview, if everything is in order, then approval will be made, and then they'll get the payment. So I'll ask my colleague to supplement on the details. Yes? Well, speaker's not coming through. With regard to the applications for the Guangdong scheme, we've been doing that full steam, but then as we have already explained, some elders, in fact, right from the beginning, we have already told them to submit the application forms. We have already streamlined the procedures, and after looking at the application forms, and if all the details are there, then we'll make a phone call, we'll call them up, and then after all the details are submitted, we'll make an appointment with them, and we will tell them that under the Guangdong scheme, there are things that they will have to pay attention to, and if there are any changes to the addresses and so on, they will have to inform us. But then, as we have said, we have already tried our best to do it full steam, and we have expeditiously processed their replications. Can I supplement on the OALA? Will we seriously consider doing that? Why do we only consider that by the end of this year? Because it's been in place for only a few months, and by the end of this year is 12 years, and also together with the 2 schemes which have been in place for some time, we'll be able to accumulate more experience on the ground, because for the OALA is different from the Guangdong scheme, because the Guangdong scheme is about the OAA. So long as they are alive and kicking, they will be able to get it. But then for the OALA, we have to conduct a means test. So it's about monitoring, because after all, we are using taxpayers' money. We have to ensure that it's used in the right place, on the right people. That's why we have to be more cautious. That's why we'll review the scheme by the end of this year. All right, Dr. Liang Ka-Lau, in the first round, 5 minutes. I'm just being a nosy Parker in a paper. I read it on the cell phone. All right, with regard to the paramedical staff, you said that you'd like to hire more young people, and there are 1,000 places for the paramedical staff. So how many people are there, and how many hours do they have to work, and how much are they paid? And then there are also some part-time programs to be offered by the OpenU. And after completion, what kind of qualification does that offer to them? Well, I'll say a few words, and then I'll ask the Assistant Director and Madam Li Yunhua to explain. Yes, since September last year, the Lotteries Fund has made this attempt, and we'd like to attract more young people to join the care services profession. So number one, when they work in the homes, they have to work about 40 hours, earning about $8,000 a month, and then on 2 evenings, they will be released so that they can attend a course at the OpenU, and it's a diploma course in health studies, community health care course, so it's a QF4. So it's a diploma course, and then they'll be able to learn on the job, so that after they've obtained the qualification, then they can become a carer, and then after they have acquired the qualification, they can also become enrolled nurse. And then we will try to nurture the talent, so they would not just be working on the front line, because many young people do not want to become frontline carers for their whole life. That's why there will be career development, so there will be upward movement, so that after they have completed the training, they can move up. So we are working in that direction. This is a pilot scheme, and the response has been so far so good. So we have set aside 1,000 places, but then, as I said, if the response is good, then we can get more resources. We hope to have more people joining the profession in order to meet the demand. I'll defer to my colleague to supplement. Well, first on the pilot scheme. So we have looked at the response to the scheme, and if it's successful, we have announced that we're going to increase the number by 1,000 in the next few years. All right, for the previous pilot scheme, Well, in 2013, most of the students were the school leavers under the new secondary school curriculum, and then we will be recruiting them, and some pre-course training has been offered, and then in July, August, they also went to some of the private homes to do on-the-job training, and starting from September, they have started class training in OpenU, and we have already recruited some 90, and the quota is about 100, and you can see that there is this sense of coercion, there is this sense of collaboration, and then they are trying to encourage one another, and then under the scheme, we also have a number of mentors, and then as far as Hot Yun is concerned, they've provided a lot of support, and we have also asked the RCHE to provide support to these trainees because they do not have a lot of experience. In fact, I am only seeking some information. So you're talking about $8,000 a month for each trainee, and then they will have to work 40 hours a week. And then there will be 2 evenings on which they can go to the OpenU for classes, and then that would be over and above the 40 hours, right? Well, they have to work for 40 hours a week, and then on top of that, they will have to attend 2 evening classes, and there will be some time for them to read up the materials. All right, after they have acquired or obtained the diploma, so it's like an enrolled nurse. Well, after the first year of training, if they pass the grade, then they can become a carer, and then they will have a wage rise. But then when will they become a registered nurse or an enrolled nurse? No, it's not supposed to be training for enrolled nurses. So it's a career ladder, and after they've completed the program from the perspective of the OpenU, all right, as far as enrolled nurses are concerned, they can also be articulated to the enrolled nurse program run by the OpenU. But then for any S5, S6 school leaver, they will be able to enroll into those programs. Yes, for S5, S6, yes, they can enroll in those courses. All right? I'm just interested. All right, if they can become enrolled nurse, that they do not have to do it in such a convoluted manner. So I'd like to know if there are any other members who would like to ask in the first, second, or third round. If none, then we still have some time to go. We can have the third round. If someone would like to ask, then I will not be asking in the third round. If not, then I'll be asking in the third round. All right, para 70 was about custodial or child custody and access. So I'd like to know the timetable on the legislation. You may not have that with you, but then please let us know. And then you talk about the home help service for the severely disabled, and you think that you have done a good job. That's why you're trying to extend it to the entire territory. But then how do you know that you've done a good job? Do you have any report or assessment? So even if you don't have the information with you, we'd like to know that. And also in para 38, I'm most concerned about this. That is for the fund. You have an additional $470 million, but then the most important thing is in different areas in terms of paramedics and so on. But then what I'd like to know is, so after the breakdown, so can you give us the breakdown? Because as far as we are concerned, what we'd like to know is we'd like to monitor the performance of the individual institutions. They should not be violating the funds, and if they are having centralized staff and also paramedics and so on, we'd like to know the proportion. So please do give us the breakdowns. Another question is para 31, and here you are talking about enhancing preschool rehabilitation services. All right, you only talk about the training subsidy for children from low-income families. But what I'd like to tell you is that according to many middle-class people, they are not eligible for this, but then they very much like to get the service. And then for the current subsidy or for the current subvented services, there is a shortage of that. all right, you have offered this training subsidy, you have a group of people coming up for that, and therefore they have been squeezed out and they have to go for private services. In other words, they will have to pay more for that. So, will you be increasing preschool rehabilitation services instead of doing it by way of offering this training subsidy? Thank you. Chairman, I'll try to answer some of these, but then I'll have to ask my colleague to answer the rest. We have an assistant director on that. First of all, on the LRC report on children custody and access, we will follow up on the report and get back to you later. The next step is to take it up with the DFJ and the relevant departments. We will try to see how this can be taken forward. Well, the ultimate objective is to legislate, but then we need more time to do more analysis. What's more important is to consult the stakeholders, including the two streams of the legal profession, the law society, and so on, before we enact legislation. But then the direction is to enact legislation in order to implement the recommendation of the LRC report. So that's the direction to take. How about the stakeholders? You will have to consult them. Yes, women's groups, welfare, and social workers, and we may even have to come back to get your views before we actually start the drafting. So we will have to grasp the time, but then within this year, tabling the legislation within this year is not very likely because we only have a few more months to go. But then we'll try to grasp the time in order to enact the legislation. And you also refer to the lump sum grant. It's relatively simple. For the out of the $400 million, well, some of it would be used for keeping a talent, about 100 million for the medical staff and so on, and then for the remaining 300 million, that will be given to the institution for centralized staffing and so on. So about a quarter would be for the latter and 3/4. So there are 4 elements here. What's most important is support. So we would like to provide more support staff, and then for the supervisory staff, and then for paramedics and so on, it would account for some 1/4. So can you give us the breakdown for the 4 elements? And then I'll ask Mr. Fong to tell you more about preschool rehabilitation services, or Ms. Lee can tell you more. Yes, on the home care service, because it's a pilot scheme under the Lotteries Fund, so we are conducting this midterm and final review. And then for the preschool rehabilitation services, well, the CCF project has to has this means test element, and we will be reviewing this. But then, well, we are not just regularizing it. As the Bureau Director said, for preschool services in the coming 5 years, we're going to have 1,471 places.
And 3 types of preschool services are provided. So we are taking a 2-pronged approach. Thank you. So if there are no other questions, meeting is adjourned. Thank you. So wish you Happy New Year and good health.
同政府忙啊！